Hey everybody, Marlene Yvette here. I am back. I'm going to try to go through this very quickly. My baby girl's taking a nap and she likes to come and help me as I'm recording. So if you recall from one of the previous videos, I was going over Inwood Village Pediatrics, which is her doctor's office, talking about a little bit of the Children's Medical Center Trust correlation again, trying to figure out why I never got results from the hospital. This was the patient portal agreement. I already showed you that. This was the patient portal that apparently her father, Creed Johnson, set up. Showed you that. It was just another page of information. I showed you Mariah's portal and her page there. And then we went on to talk about the $133 bill that I didn't understand where it came from, and that's how I wasn't looking for records, but God showed me that they existed. Again, going in to take her for her 2-year well check appointment, as I had stayed on top of all of that, and then finding out he took her on the 16th. Of course, trying to run her in there with any complaint he can come up with, check her iron, make sure it's low. My daughter has also had feeding delays as a breastfed baby, which is very natural and very healthy, and she's been thriving ever since birth. And so he, even though I informed him that her iron was up to par and had been cleared through a WIC appointment, I guess he wanted to try to just get anything he could when he got her on February 9th. And of course that turned up, that her iron was awesome, 11.8. You'll see that in the report here in a minute. But again, this was the appointment history where I went over how once they realized I wasn't going to pay his bill per the court order that they're trying to enforce, which says he's responsible for the bills obtained when he gets care for her, they stated that I walked out, which of course is not the case, and I have audio to disprove. Deal with that later. So now, of course, this is, I think, where I left off. I was talking about the clinical summaries, the PDFs, to show that PDFs do exist for what I'm getting ready to show you. Again, 2.6 here, and going down the page here, you can see, again, I didn't print this information out, didn't get it till 3/29/2016, which was last Tuesday, the day before the show cause hearing that I was going to before my son had his accident, and on the way to court. So again, I'm going to go up to here Tuesday, March 29, 2016 at 12:17 p.m., 41 seconds. This is where, again, we've got further patient chart summaries saying that her patient medical records went out on November 9th of 2015, though I'm not really sure to whom, maybe perhaps to him and his attorney, I don't know. And then 9/18/2015, 8/4/2015, 7/14/2015. Now I'm going to go to some of these reports just to show you what they look like. Okay, this one has the date on it, a visit date being 7/14/2015. This one has the date of the next one, to show you. Has the date of 8/4/2015. Turning the page, nothing on the back there. The next one is going to be the 9/18/2015 report. And of course, that's just the back side of it, signed by her doctor, Grace Corey. Then we've got the 11/9/2015 report. Again, signed by her doctor, Grace Corey. And now we've got the 2/15/2016. Apparently he had set up an appointment and apparently no-showed. That's what it says is the diagnosis, no-show, active problems. It says 9/18 anemia onset, 9/18/2015. I believe that's when they found out that her iron was a little bit low. Atopic dermatitis, unspecified onset. It says 2/16/2016. I'm not really sure how excuse me, they did the visit date on 2/15 and then have this for 2/16. I don't really know, but it says encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm onset, 2/16/2016, and that's showing that the anemia is actually resolved. So again, showing that her anemia is just fine. And then it says no-show onset for 2/15/2016 is unspecified contact dermatitis, unspecified cause onset. You have no future appointment scheduled, and of course that's signed by the doctor. This was electronically signed apparently on 2/18/2016 at 7:10 p.m. And now I'm going to go to the 2/16/2016 report. So now here is where apparently he did take her in. It's saying the diagnosis was therefore encounter to follow-up examination after completed treatment for conditions other than malignant neoplasm, anemia resolved, atopic dermatitis unspecified. I'm not really sure what it says. Anemia, well, I guess anemia onset 9/18/2015. It says encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, onset 2/16/2016, anemia resolved. And then it talks about medical records received in onset 8/4/2015. That's when they came from her first pediatrician. No-show onset 2/15/2016. And then it's showing unspecified contact dermatitis, unspecified cause onset 9/18/2015. And apparently there's other things that she was having problems with after being with her father. Again, she was turned over illegally, unlawfully kidnapped by the Collin County Courts, Judge Emily Miskell of the 470th, and sheriffs put into her grandmother's car, who was not a party to our suit, who did not have a grandparent's suit or right in the case, but they buckled my daughter away from me as a fit mother into her car. They had her on February 9th, so this report was taken February 16th, and it said that he was reporting a right eye teary. Could be either allergy versus viral versus blocked tear duct. Monitor closely. Then it says atopic dermatitis, care given. Then it shows anemia resolved. Continue to introduce iron-rich foods. Then it shows 4 RTC in 4 weeks for flu shot number 2. So apparently she had flu shot number 1. Didn't know that. It says hyperpigmentation is most likely reaction to healing diaper rash or atopic dermatitis. She actually has, I think they call it Mongolian spots. It's listed in some of her previous records. It's just where some children have darker skin on their backside, and they've had it since birth, and she's one of those, and so ultimately that's what she's referring to there. But again, it shows her hemoglobin. Her iron is at 11.8, so 11.0 is where they want to see it, and she's doing great. Again, this says this was electronically signed by Grace Corey, MD, on 2/16/2016 at 8:50 p.m. So now we're going to go over the report that I didn't know existed, but obviously God needed me to see. There was medical proof of her condition the week before she was returned and went to the ER. So this is the critical information here. Again, we're going to see Mariah Vet here at the top. There's our address, her birth date, Greenville Avenue, Allen, Texas, electronic chart here. So now we're going to go over the visit date, 2/16/2016. So again, this is my daughter. Here's the medical record. Again, showing mom as primary, showing that the visit last changed at 2/16/16 at 8:50 p.m. Again, that's where the doctor apparently went and signed, but it says 22-month-old female with HX of anemia, I guess that means history, presents with dad for a check on concerns about her right eye teary, tugging at her ears, and diaper rash. Dad has visitation rights recently for the next 2 weeks, and PGM, paternal grandmother, is helping him with Mariah. Per dad, she is eating very well and eating more table foods. She is talking more and is happy all the time. She presented with parental concerns of ear pain. In addition, she presented with eye tearing. The patient also presented with dermatitis, atopic. So this is after they've had her for about a week. Now, review of history. It says, I reviewed the documented immunization history. And incidentally, I'm glad that he took her to the doctor if she was having these problems. Although I think it was a race to kind of get in there and find anything wrong with her. But if she really had problems and he really was getting her treated, then that's a great sign. The problem where it's not a great sign is what we're going to go over here in just a minute. But apparently this is just a review of the exam, and it talks about constitutional. The patient denied concerns, decreased appetite, decreased fluid intake, fever and lethargy, ears, nose, throat, and neck. It says the patient complained of ear pain, but denied congestion, runny nose, snuffy nose, and sore throat. Again, I want to read over what I just read so that you can see that it's actually there. Respiratory, the patient denied concerns, cough, nasal discharge, short of breath, and wheezing. Musculoskeletal, the patient denied concerns. Eyes, the patient complained of eye tearing right but denied eye discharge. Gastrointestinal, the patient denied concerns. Vomiting, diarrhea, and constipation. Cardiovascular, the patient denied concerns. Genitourinary, the patient denied concerns. Dermatologic, the patient complained of rash, diaper rash. So again, I just want to go over so you can see that this is what I'm actually reading. Neurologic, the patient denied concerns. Psychiatric, the patient denied concerns. Endocrine, the patient denied no concerns. Hematologic, lymphatic, the patient denied no concerns. And so that's saying, I believe, that he does have endocrine, hematologic, and lymphatic concerns, and allergy, immunology concerns. The patient denied no concerns. Now, we're going to go to her vital signs. Again, this was generated on, originally the report generated apparently on 3/24. Because this was the one that they actually gave me in the doctor's office when I took her to be seen for her 2-year check on 3/24. So now we're back here. It talks about her height, her weight, her BMI, her temperature, her RR, her HR, her BP, her BP2, her head circumference, SpO2, and her waist. It shows that she was 24 pounds, 6 ounces. Her temperature was 99.1, so it looks like she did have just a very slight fever, nothing major, but this was at 2/16/2016, 1:56 p.m. by Suhey Gallardo. Maybe mispronouncing that. So now, again, something I didn't know existed. This is PE for, I believe, physical exam. It says constitutional general appearance, overall and no acute distress and alert. Talks about head, inspection of head, overall normal shape. Then it talks about eyes, ophthalmoscopic exam, overall, perla and EOMI, I don't know what that means. Conjunctiva, eyelids, overall, conjunctiva, clear and no discharge. Ears, nose, and throat exam. Looks like otoscopic exam. Tympanic membranes, pearly gray and with good light reflex. Internal nose, overall, bilateral, nasal cavities clear. Oral cavity, it looks like the pharynx and the larynx. Throat moist, mucosal, no lesions in pink. Tell you medical terms are not my specialty, so I may be butchering these words, but hopefully you can see them here on the page. Now we're going to talk about her neck. Inspection of her neck, overall, supple and no significant nodes. Respiratory, overall CTA, respiratory effort rhythm, overall no refractions, no grunting, and no nasal flaring. Cardiovascular, breast chest inspection. Before that cardiovascular, escalation of heart, overall regular rhythm, normal heart sounds, no murmurs, and regular rate. So that's page 2 of 5. Okay, now we're going to turn the page. Now we're going to go to the page that, again, I thought to myself before she went, I wish I would have gotten it. I didn't know that they would go through such a thorough examination, but here's where I found out that they did. Again, overall normal chest shape is what they reported there. It says for her abdominal exam, overall soft, benign, no whatever that means, no tenderness, no masses, and normal bowel sounds. Now we get to her genitourinary area, which is her labia and her vagina. Overall normal infant. No other reports, nothing about swelling, nothing about vaginal discharge, nothing. Overall normal infant. Now we're going to go to lymphatic, neck nodes, overall normal. Musculoskeletal exam, overall. Skin, inspection of skin. Overall, dark pigmentation in the inguinal area. No rash seen, or pustules, or redness, or discharge. I'm going to go back to this. This is the skin. The skin, again, for this 216 visit, it's saying overall dark pigmentation in this area, no rash seen, or pustules, or redness, or discharge. Overall skin seems slightly dry, but no patches seen, and no rashes or lesions. This is going to be very important in a moment. Now we're going to go to neurologic, general, overall oriented, good eye contact, and is alert. Now, the DX, or the diagnosis, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, anemia, resolved. And she just says atopic dermatitis unspecified. It says services performed, and this is where the bill came from. Hemoglobin. Okay. Saying the blood draw, stat lab, flu vaccine, and the various different things. And again, showing everything that was done there. So now we're going to turn the page again. And we're going to go ahead and get to the results associated with this visit, which was hemoglobin 11.8. She's in range. Great. Then we've got right eye teary. Could be either allergy versus viral, blocked tear duct, monitor closely. Again, atopic dermatitis, care given. Anemia resolved. Continue to introduce iron-rich foods. RTC in 4 weeks for flu shot number 2. Hyperpigmentation is most likely reaction to healing diaper rash or atopic dermatitis. Goes to medication history, and it goes over all of her history, all of her shots that are up to date and current. Now turning the page again. Now we're going to go back up to where it's talking about further shots she's received, problems, and again, electronically signed by Grace Corey, MD, on 2/16/16 at 8:50 p.m. Again, this was generated on 3/24 when I asked them to print it out, and this is page 5 of 5. Okay, so again, a report I was not looking for, I did not know existed. I wasn't searching for when she came back. I was just simply on March 24th trying to take her to her 2-year well check to go ahead and get that done. There is also an email that I sent him notifying him that there was a bill that had to be paid because I was not able to have her seen that day until it is paid. And of course he never responded. That particular email chain was another demand for visitation, which I wasn't allowing after what I discovered physically and what records confirmed in her being returned. Also based on the fact that we still have the ordering and enforcement of void orders where the court has lost jurisdiction due to its fraud and other matters that I'm going to explain later, but ultimately, most importantly for her safety and my duty to protect under the Penal Code, Family Code, and also Texas CPS Code and Procedures. Now we're going to go to the actual records that I got from her Children's Hospital discharge visit. Again, I'm going to go ahead and go down to the bottom where it shows that this was printed out for Mariah Saray Yvette. There's an MR number printed at 3/25/16 at 12:33 a.m. That's about the time that we left the hospital. And so I'm going to go ahead and go over this quickly. I'm going to actually take it out of the slick so I can go over the notes that were given to me. It does show at the top the encounter date, which is when I actually took her in, her brother and I, 2/24/2016, and I'm just going to go over the results here. Again, this is showing the hospital, Children's Medical Center, Plano, Preston Road, Plano, Texas. Mariah Saray Yvette, 2/24/2016, 11:29 p.m., hospital encounter. Again, it's showing this was in the emergency room. Female, date of birth 3/18/2014. It's showing that the diagnosis was simply diaper dermatitis, no active allergies, Weight this visit, where'd it go? Was showing that she is 11.5 kilograms, so 25 pounds, 5.7 ounces. Saying the medications that were prescribed was acetaminophen, commonly known as Tylenol, and that, I guess, was just for pain. And then it says, please give this medicine list to the doctor or caregiver who is central or main person who treats your child. Medicine doses are changed. Your child begins taking new medications. This includes over-the-counter medicines. Please carry a medicine list with you at all times in case of an emergency situation. Looks like generic information. It says they'll want this list. Please update this list when those things occur. So it's going to say follow-up information, none. We can see that there. Future appointments, this is when she did have scheduled, and apparently they are a part of the same organization now, is 3/25/2016 at 9:30 a.m. for OCH Dallas, which is our Children's House Dallas. That was Baylor, but now apparently it's all a part of Children's. Their direct phone 214-820-9850. There it is, department phone. So now it says sign up for my chart, and I'm going to show where I did sign up for my chart. Children's Online provides you with the essential tools to manage Mariah's care when you aren't at the hospital. It says register online by going to www.childrens.com and click on the register link at the top of the page. Follow the instructions on the link. Again, it's showing when this was printed. For Mariah Surrey Vet, 12:33 a.m. Printed at 2/25/16. Okay. Now I'm going to go ahead and turn the page. So you can see me turning the page here in this binder. I now go to all the stuff on the back, which just says simply, again, it's still all the same here at the top. Encounter date here, 2/24/2016. Non-specific dermatitis child. Now, it says dermatitis is a skin rash caused by something that makes the skin irritated and inflamed. Your child's skin may be red, swollen, dry, and may be cracked. Blisters may form and ooze. The rash will itch. Dermatitis can form on the face and neck, back of hands, forearms, genitals, and lower legs. Dermatitis is not passed from person to person. That's going to be in critical information in a minute. It says dermatitis is not passed from person to person. Okay? Talk with your healthcare provider about what may be causing your child's rash. This will help to rule out any serious causes of a skin rash. In some cases, the cause of the dermatitis may not be found. Treatment is done to relieve itching and prevent the rash from coming back. The rash should go away in a few days to a few weeks. Okay, so all of that I feel, pretty clear about. It says that the home care is the healthcare provider may prescribe medications to relieve swelling and itching. Follow all instructions when using these medications on your child. Follow your healthcare provider's instructions on how to care for your child's rash. Bathe your child in warm, not hot water with mild soap. Ask your child's healthcare provider if you should apply petroleum jelly or cream after bathing. That says expose the affected area to the air so that it dries completely. Do not use a hairdryer on the skin. Dress your child in loose cotton clothing. Make sure your child does not scratch the affected area. This can delay healing. It can also cause a bacterial infection. You may need to use soft scratch mittens that cover your child's hands. Apply cold compresses to your child's sores to help soothe symptoms. Do this for 30 minutes, 3 to 4 times a day. You can make a cold compress by soaking a cloth in cold water. Squeeze out excess water. You can add colloidal oatmeal to the water to help reduce itching. You can also help relieve large areas of itching by giving your child a lukewarm bath with colloidal oatmeal added to the water. You may use 1% hydrocortisone cream once a day to help with inflammation. Follow-up care. Follow up with your child's healthcare provider. Contact your child's healthcare provider if the rash is not better in 2 weeks. Special note to parents. Wash your hands well with soap and warm water before and after caring for your child. When to seek medical advice, call your child's healthcare provider right away if any of these occur. Fever of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, redness or swelling that gets worse, pain that gets worse, babies may show pain with fussiness that can't be soothed, foul smelling, fluid leaking from the skin, blisters. And this is taken from 2000 to 2015, Staywell Company, LLC, at 780 Township Line Road, Yardley, Pennsylvania, 19067. All rights reserved. This information is not intended as a substitute for professional medical care. Always follow your health care professional's instructions. And again, just showing it as part of the same report, 12:33 a.m., printed at 2/25/16. Now, I'm going to go back to the document here, and there's nothing on this final page. Just shows, again, printed same time. Okay, oop, it just fell. So now we're going to put that back up there. Okay, at this point, I needed to go through all of that as we're getting ready to move forward with now when after the 224 visit I found out he took her. Again, I'd been trying to get temporary orders hearings from 222 to 3/2 of 2016, so for 10 days, to just have our father and our father's attorney be able to present why she came back with a swollen vagina, why she came back with vaginal fluids coming out of her, and just have their opportunity to dispute whatever concerns are. Now, again, 7 individuals of the Collin County Courthouse, one who I don't fault, she was forced, but the other 6, absolutely intentionally, for some reason, they were not okay for us to have a conversation at all about her condition when with her father for 2 weeks. And once I found that report that I was not even looking for, later on that day I was just prompted to go ahead and get results I didn't want to get. Now, I mentioned in another video that after I took her to the ER, one of the things, I may not have mentioned this in the other video, but you'll hear this on the audio. One of the concerns that I had, besides the ER doctor and the hospital social worker there at Children's trying to pretty much talk me out of not having her investigated forensically for sexual child abuse. Again, you'll hear all that, so I don't want to get into it too much. The other disturbance that I had was before we left the hospital, noticing that the doctor actually did take a swab from my daughter's vagina of the fluid that was coming out of her. And after taking that and then finding out there was a custody case, all of a sudden that doctor very quickly wasn't a medical doctor with medical questions anymore. After she had stated, looks like poor hygiene, all of a sudden she became an attorney. And she's asking all these legal questions as to, well, why did he have her for 2 weeks and why is she getting ready to go back? And then all of a sudden she was very disinterested in pursuing any further investigation of why this child, why my daughter came in with a swollen vagina with vaginal discharge that you will hear her on the audio saying, yes, I see it, I need to take a swab of it. Of course, they're trying to do that, my daughter freaking out, and again, proof that she took a swab lab sample of fluid coming out of my daughter's vagina, with me not stating definite allegations of sexual child abuse, but concern, making it very clear that I was concerned that something happened, so the medical doctor knew that. She knew that there were signs that were suspicious and also along the lines of signs of child abuse in toddlers. And so I found out later that there is a law in Texas that say that hospitals are supposed to handle that a certain way. Definitely we know that professionals, even under the suspicion of abuse, they are mandated reporters by law, and if they don't, there's a big problem. And so all of this will come up here shortly when we continue to go through the records. But ultimately, after that day and that particular visit, realizing that all this time, as one of the things the hospital social worker said to me, is if you have her forensically interviewed, then yes, it could backfire against you because you're in a custody battle, and ultimately all the attorney and her dad has to do is get the records where the doctor's saying it's diaper dermatitis. Now, where I finally decided to go ahead and get the records was because I was also thinking to myself, why does it take 7 people to make sure I can't file to have a conversation about what happened to my daughter? Why are they all secreting it? What is so bad about records that they're trying to keep out? I told my pastor, I told family and friends, I don't want to get the records. Because the other thing that disturbed me in that visit, after the social worker told me everything she told me, after the ER doctor showed no interest in further evaluating my daughter and actually told me that it would be very hard to tell if something had happened to her anyways, is before we left, the sample that was taken from her vagina, from the fluids coming from her vagina, was left sitting on the counter. So I remember telling our nurse at discharge, they were supposed to sample this, can you make sure that they get it? Prior to that, Holy Spirit led me to go ahead and take a picture of it, so I do have a picture of what that sample tube looked like, left sitting on the counter after it was taken by the ER doctor. So that probably has its set of own issues of negligence on behalf of the hospital, but ultimately the nurse said, oh sure, no problem, I'll make sure it gets to where it's going. So, that being the case, one of the things I was afraid of is I already had my good suspicions. I will say his own brother and sister-in-law told me about various different abuse within the family, including child sexual abuse and molestation that is accepted. Nobody cares, and those family members are still welcome around the Thanksgiving table regardless. For those of you that understand the patterns of abuse is unfortunately hurt people, and they believe that that's normal. It's a normal way to love. It's a normal engagement with children, which of course those of us that know better know it's not. And so there was also other factors besides the incident where for over 3 hours our daughter was secreted from both the Colony and then Dallas Police Department for over 3 hours. He lied to the Colony PD. Again, I do have that police report. I'll go over that. And then he ultimately would not even let either one of the departments do a health and safety welfare check on her early that Sunday morning, which the first call of the Colony started about 9 a.m. The whole call, the last call I got from Officer Hogan of Dallas PD was not until 12:40. So this whole incident where simply I just needed officers to eyeball my daughter and see that she's safe and secure, she's not harmed. That went on from 9 a.m. to 12:40 p.m. on Sunday, February 21st, while he had her, the last few days he had her, and they could not physically see her, but again, I was notified by Officer Hogan of DPD, have no fear, I was able to FaceTime with your daughter, which again, I didn't know police departments did on health and safety welfare checks. The purpose that I even called for the health and safety welfare check is I had asked just simply how she was doing, sent him an email. Her 11-year-old brother wanted to say hello to her and just communicate, and he had already agreed, please continue to limit your communications, because I had only sent a communication maybe once every 3 days, just simply say, hey, checking in, just wanted to see how she's doing. Now granted, when I had her, this is a man that would email me 30, 40, 50 times saying he's concerned about the well-being of our daughter, and I would respond to every single email. So when he got her for 2 weeks, I contacted him maybe 3 or 4 times, again, every few days, to just simply say, how's she doing? He did agree that I could reach back out and continue to limit my communications. And so that's what I did, was on that Thursday, which I believe was the 18th, I just simply sent an email to which he never responded. He had sent me pictures before. The pictures were a little bit concerning. One of them was where she just looked really blank, confused, and just not normal. But again, I didn't panic. I didn't freak out. I wasn't fighting the court orders. Wasn't fighting her father. Wasn't alleging anything. But when he did not communicate on Thursday, on Friday, on Saturday, or on Sunday morning I had to go check on my baby, and I just needed police to eyeball her personally, physically, and see that she was in a safe environment, see that she was safe, see that he had not moved forward with enacting the threats he had made for our daughter's kidnapping, which is me continuing to fight for supervised visitation. This is how people end up shot in the penitentiary, kids come up missing and not being returned. I needed to make sure she was safe. So again, all things considered, once I found out that there was a report I didn't know existed, but they didn't bring it up in court, which led me to figure out why. And then realizing I never got a phone call from Children's Hospital with the results of her lab of the vaginal swab that was taken from my daughter's vagina, her 23-month-old vagina. I got a bunch of customer service, take a survey, how did we do calls, but I never got one about the results showed the following. And so finally on that day, I got the strength to go ahead and try to go up there and get the records. Previously, I'd been told that I'd have to pay a lot of money I didn't have, that I would have to request them through the online system, that I'd have to send off for them and wait for weeks, and so that was the other reason I just wasn't jumping up and down to get the records. But finally, I was prompted to go ahead and ask, and I went ahead and moved forward to do that. Again, the reason I did not want to go for a month was because I said if the hospital tries to allege we did not take a sample of fluid coming out of your daughter's vagina, that would be about all the confirmation that I need to what I already knew in my mother's heart, but was just trying to not make the allegation and trying to move on with. I said if there's any reason that the hospital has to say, no, we didn't take a sample from her vagina, I would then know that, again, there's additional cover-ups going on besides just the court system that refused to allow me to file my evidence and have a TRO hearing as to where was she, why was she secreted from police, and ultimately, why did she come back in the state that she was? I did not want the answer and confirmation. Unfortunately, sometimes we have to be strong enough to get a terrible truth, and so that's what I did on 3/24. I went and I submitted what we've been staring at is a Children's Hospital, again, Legacy, they're in Plano. It says Dallas there at the top, but then also has Legacy Plano location. It is my authorization for the inspection, use, disclosure, and release of health information. Again, you'll see that this is my daughter's name, 31814. I guess that's a medical record number there. It says the release method that they're releasing is paper. It says the purpose of the request is to inspect health information, obtain a copy of health information, release health information to the persons identified below, which is mom, and then of course I selected the other ones here. I said to identify the dates of the health information requested. When I got there, Linda at the records office notified me that she could print out the labs, but not the entire report. I'd have to set up an online account for that. And so I went ahead and requested 224 and 225-16 because our visit there actually went from the evening of 224 to the early morning of 225-16, as you saw there, about 12:33, I believe it was, somewhere in the morning on 225. And so I wanted that report. And then I just said, and any others from 318-14 from birth. So I'd like the lab results. It shows that this was received March 24th, 2015. Patient was here, legally authorized representative, which would be me, Marlene Yvette. There's my address there in Ellen. Okay. And then it shows when I made that request, which again was on 3/24/16 at 2:43 p.m. Relationship to patient, mom. Again, how did I present that? Security identity verification, photo ID I presented to them. And then of course here's my signature and also name. So now I'm going to go ahead and flip the page here in my book. I'm going to show, this is the envelope that they actually delivered those physical records in. Here is the name tag to show I was a guest there on 3/24. Destination, outpatient records. This is something else that I was also given. As you read about this before, it says My Chart instructions. What is My Chart? It's an online account to view medical records, labs, pathology and radiology, create, cancel appointments, to communicate with the doctors and request records. At no cost, you can request records to be sent to an outside facility, disabilities, schools, or for yourself. Create a new account. Again, it says go to childrens.com website. Scroll down and select orange icon that says log into My Chart. Create an account as a parent or a patient. Okay, and you'll need the medical record number to finish creating an account. And it says please call 214-456-2509 or 469-303-2509 if you don't have the medical record number available. So she circled there, log into My Chart, check on My Healthcare World, click on download on the right. Okay, and those are the instructions that she gave me. So again, here is that document. So then you can see now the email that I received that says welcome to Children's Medical Center portal. It shows from CMC_PAdmin@childrens.com. And then it shows to ourfreedom2015@yahoo.com, which is my email address, Thursday, March 24, 2016 at 2:55 p.m. Again, consistent with everything here. It says thank you for registering at childrens.com. What I'm doing right now for legal purposes is to authenticate that this whole process took place. Okay, and I'm going ahead and going down the page, and again, this printout was done on 3/28/2016, but of course again when it was actually generated, Thursday, March 24, 2016, 2:55 p.m., again consistent when I was a guest there at Children's Hospital. Now I'm going to turn the page again so you can see me turning the page. And then now the next email, when we finally went through, what they do is I set up the account, then she releases the records, and I'm able to print them. So this one shows the time now, Thursday, March 24, 2016 at 3:03 p.m. Okay, again, welcome to Children's Medical Center, patient records. And it says, Marlena, your request to access patient medical records from Children's Medical Center has been completed. In order to access this information, please sign in to the Children's website at https://online.childrens.com. Thank you again, Children's Medical Center. This message was created by an automated system. Please do not reply. Again, I'm going to go down the page. Again, it's just showing the Yahoo link here. And again, it's going to show the date that I actually printed this out, 3/28/2016. Now we're going to go to the next page. You see I haven't moved anything. I'm in the same book. And now it says download records. Children's Health. And here's the download records function. It printed out. Again, it shows me here at the top, welcome Marlena. The sign out, accounts and settings, English, Espanol, page 1 of 1. So again, showing this is where I downloaded. So again, I'm turning the page in the book, same book, nothing on the back there. And so now we're going to go ahead and get to her records. This is showing all the various different records. Now there is something to note. I don't want to get too far off into it, but there was another visit where the labs were messed up by Children's Hospital with regards to mold and lead samples and testing, but I'm not going to get into that right now. I'm just going to show the various encounter dates. 4/10/14 she was seen there. Again, that's the back side of that. This is a report they did at EEG on her. This was apparently also April 10th, 2014. Just turn the page again. This was a further report on that. So again, this is showing now, this is 8/12/2014. And again, turning the page here, same date and time. This was for 9/30/2014. This is when she was seen there, 10/30/2014. Again, I'm saying I think she may have a fever, state's apartment, just diagnosed with mold since Friday, only a couple of times. Diarrhea since Saturday, off and on. Now, it was an apartment. It was actually a new home that we had just moved into in Allen. We were moving in. I was supposed to start a brand new job the following Monday. Great new opportunity. This legal case also destroyed that, besides the toxic house in Allen, that Allen judges should have protected us from in a repair and remedy suit to make the landlord make correct, but instead they didn't. They found in his favor, ripped our home away from us, and so with a very, very recent eviction, I believe that finally was finalized as of February of 2015. Again, it's been really hard for us to be able to get housing, and we're currently at an extended stay, which they do call residences. It is a 2-bedroom with a full kitchen, full bathroom, 2 separate bedrooms. Again, just me, my 17-year-old son, my baby girl, and then my 11-year-old when he's with us. So it is still an apartment, every aspect an apartment. They refer to it that way, except for the difference of being locked into a long-term lease. And ultimately, got to be able to pass a criminal background check. And so, other than that, they're apartments. They've got school children there all over the place, all throughout the complex. Buses come there. And again, it's just like a complex, except it just doesn't have all the rigorous qualifications as regular apartments and homes do, because Collin County helped to destroy that for us. I'm also going to address, if you look at my name in Collin County records, I will address all the various different eviction filings that you see. The majority of them are retaliatory from landlords that simply didn't want to fix issues. There are a couple that were legitimate due to financial difficulties, which also comes with domestic violence, the cycle of it, and the various different effects of it. And so I actually will go through and outline those in detail as well. But I want to go ahead and stay focused and stay on track here. I also mention this because that is the only thing he has against me that now he's trying to use to attack. Granted, Collin County has ignored his admissions of murder to a judge and secreted that hearing. We'll talk about that. They've ignored the fact that he's got an extensive criminal background, that he did not deny engaging in drug dealing at this time, that he has continued to never demonstrate his ability to act in the best interest of the child and or to amicably co-parent, that he has threatened kidnapping, that they now know he has been physically neglectful, and the list goes on and on and on and on, with also other issues with the paternal family. The fact that they ultimately did not care about her feeding delays and even allow me to drive back and forth on void illegal orders that I was willing to do for her to make sure that her physical needs were met as well as her emotional needs met and her not traumatized. All of these various different things, and now we want to just simply get down to, we found out she's living at a hotel with other people. That's what's in the motion. That's not exactly the case. Again, we're living in residences that actually have a lease that you sign. They have to evict you from it before they can just put you out, so it's not exactly a hotel. And I'm not living with other people. She's living with her mother, her oldest, her third oldest brother, and herself. So again, the only thing they have against me is they've just recently found out that she's living in a hotel with other people. Again, not accurate, very misleading. And even if that were the case, Again, we'll address and talk about that later. A very safe, loving, non-physically neglectful environment, non-sexually abusive environment, non-drug using, drug dealing environment, non-criminal environment, non-physically, emotionally, and physically damaging environment. So again, we are bypassing all kinds of things that Collin County has fraudulently construed, hidden, covered up, tried to explain away, not allow into the record to get to where now, because she needs a 3-bedroom home with a father that is never with her. We will also address that every visit that I was supposed to take her on after the court orders was, I will send someone else to pick her up. Again, who is she with? Who's taking care of the child? We'll get into the Texas Family Code. We'll get into the sections that talk about a child under 3 and how ultimately the things that the court shall consider is the child's caregiving prior to, during the pendency of the suit, as well as the other parent's ability to personally care for the child. So again, we're not talking about taking a child from an unfit mother that has been found guilty of any type of abuse, neglect, criminal behavior, drug behavior, alcohol behavior, and now we're giving her to a fit paternal family. That is not the case that we're talking about here. And so ultimately, I want to go ahead and continue. We'll talk about a lot of those details. We're at about 45 minutes here, and I was trying to limit the length of various different videos, but we're going to go ahead and keep going. So now we're going to go to another visit that was 4/6/2015. We're going to go ahead and go to 7/6/2015. We're going to go to 8/6/2015, 11/22/2015, and now we're going to the 2/24/2016 report, which is when I brought her in. And we're going to go over these records now. If you remember some of the things that I pointed out, and I will point them out again in reviewing her Inwood Village records, this is going to be key and this is going to be important. We're going to go ahead and go through the physical exam just like we did, with the Inwood Village pediatrics exam. It says in the physical exam, constitutional, she appears well developed and well nourished. She is active, no distress. Okay. She appears well developed and well nourished. She is active, no distress. Now we're going to go to HENT. This might be head, ear, nose, and throat, but head, atraumatic, mouth and throat, mucous membranes are moist. Eyes, conjunctivi are normal. Pupils are equal, round, and reactive to light. Neck, normal range of motion. Neck supple. Cardiovascular, normal rate and regular rhythm. No murmur heard. Pulmonary and chest, effort normal and breath sounds normal. No nasal flaring or stridor, nor no respiratory distress. Okay, she has no wheezes. She has no, whatever that is. She has no rails. She exhibits no retraction. Abdominal, soft. She exhibits no distension. So now we're going to go back to this word that I'm not pronouncing well, but it's her genital area. Genitourinary. Dry skin to labia, balat. Scant, white, discharge. No, whatever that is. Rectal exam, they didn't perform one. Papules on inner thighs and labia. Now, if you remember in the previous report, it did not state any discharge. Matter of fact, it said no discharge. It didn't state any papules. Again, it says consistent with poor hygiene, which for a baby and a child would be physical neglect. Neurological, she is alert. The skin, it says skin is warm to dry. Capillary refill takes less than 3 seconds. No rash noted. Nursing note. And vitals reviewed. What I'm going to do just a moment is I'm going to go ahead and look back in here just to remind us. Matter of fact, I'm going to set this report over here to the side. And again, by the way, this is printed on 3/24/2016 at 3:05 p.m. again, which was consistent with the time that I was able to gain access to the children's records that I just showed you. Again, I want to go back to the Inwood Village Pediatrics, and I want to go ahead and show the various different medical records. Okay, so now we're back to that report again. if you remember looking at this report. So now we're going to look at the both of them together. This one generated on 3/24, and we're going to go to the review. Here. So there's a couple things we want to look at. We want to look at her genital area notes, as well as her skin notes. Okay. So again, we're going to look at her genital notes here when this was at Inwood Village Pediatrics. Again, this is the Aprima record. It says her genital area, labia, and vagina, overall normal infant. No other information here. We're going to look at skin. Inspection of skin, overall dark pigmentation in that area. No rash seen, or pustules, or redness, or discharge. Overall skin seems slightly dry, but no patches seen, and no rashes or lesions. Now let's go look at this report that says in that same area, dry skin to labia bilat, scant white discharge. Here, now it's saying papules on inner thighs. So we're not talking about the vaginal area, we're talking about now going all the way down the thighs and the labia. That before, again, was overall normal infant with no issues. Okay, so again, we want to remember that this was from the visit that took place on 3/16 and from the visit that took place on 3/24. So within the week and the time that he had her and also secreted her from the visits. I want to go ahead and get to something else really quickly. Well, we're going to stop there, and we're actually going to come back. I'll talk about the rash for a little bit. We'll try to go here. I'm going to read what the report was. Date of service 2/24, 11:40 p.m. when they finally saw us, because we waited for over an hour. 23-month-old female with a history of heart murmur presents to the ED. CO with diaper rash onset 2 weeks ago. Mother reports vaginal ERYTHEMA and vaginal discharge. According to mother, patient was with father for the past 2 weeks. Location unknown to mother. Mother took pictures of the patient's anal genital area prior to stay with father and states patient's diaper area is much more swollen and red. Mother concerned the child's reaction to taking off clothes may indicate something happened with the father. Vaccinations are up to date. Mother has a history of blood disorder and father has a history of kidney disease. No recent travel, no sick contacts. Female presenting with rash. Location, anogenital, redness and swelling. Moderate. Unchanged. No diarrhea, no fever, no sore throat, no vomiting, no wheezing. So again, this is her report. Again, he reported something and that was stated in the records, and then it was reported what the doctor actually saw at Inwood Village. This is reporting what I stated and then also what the doctor saw here. We're going to go in just a moment to, I'm just going quickly through this, where it talks about diaper dermatitis. They're going to consult social work. Gram stain and culture of vaginal swab. Plan of care at home includes frequent diaper changes, sits, baths, and hydrocortisone. And then no results found for this visit on 2/24/2016. She's just woken up from a nap, so I'm going to have to delay this, but I want everyone to see when these notes were done. This was Banzel, MD, on 2/24/2016 at 11:34 p.m. And again, this is still talking about the same admission date. Electronically signed by Barati Beatrix Banzel, MD, at 2:26/6:22 a.m. And when we return, we're going to go to the further reports. I'm going to tend to my baby girl right now.